MCQ of the day, episode 5, and this series is made with the intention that you medical students do one small topic, revise one small concept with the help of one MCQ per day, one small topic per day. So, okay, let's dive in. A 63-year-old man is diagnosed with non-muscle invasive high-grade urothelial carcinoma. So this needs a lot of explanation. What is non-muscle and high-grade urothelial carcinoma? Urothelial carcinoma, I hope that you know it is bladder cancer. It is cancer of the urinary bladder. Okay. And which of the following is the next step in the management? And the answer to this question, I am going to straightforward give you the answer. The answer is going to be intravesical BCG immunotherapy. Why not the other options? First, let me tell you a little bit about bladder cancer and its treatment. So we'll do that in a quick manner, and then we'll come back. Why not the other option? You'll understand why not the other options after the explanation. So this is the anatomy of the bladder. First of all, see who gets bladder cancer. Bladder cancer is affected by generally most affect males who are in their 50 to 70s who are smokers, and either they are smokers or either they have history of exposure of industrial chemicals. So yeah, I'm not talking about this thing. I'm talking with the point of view of competitive exams. So you will get the question stem is going to tell you that he is an elderly man, he was a smoker or ex-smoker, or he was working in some industry. So this is going to be there. It's going to serve as a clue for your diagnosis. And when bladder cancer starts, it is going to start from here. Let's say I will draw cancer from blue color, and it's going to start in this innermost layer, the endothelial layer, which is called the urothelium. Okay, it's going to start here, and it has three stages. Okay, first stage is it is non-muscle invasive. मतलब this layer here, this is the muscle layer, this layer, and this is the endothelial layer, endothelium layer. So if it has not attacked the muscle yet, then it is good news for us, for the doctors and for the patient also, that so first it stays here, and then it will progress and even attack the muscle, so it will affect the muscle layer also. Third stage obviously is metastasis. So I will draw cancer over here. This is a cancer cell outside the body. We say this is the third stage. Okay, first stage, second stage in the muscle, third stage in the body as well. So what is the treatment for plan for all three? First stage, if it is in the first stage, like we have discussed in the MCQ, it is not attacking the muscle, so we preferred mode of treatment is immunotherapy, and in immunotherapy we give BCG vaccine. So many medical students, they know BCG vaccine as a part of their vaccination schedule. In community medicine and pediatrics, you read a vaccine for tuberculosis, and you read its doses and all that. But this is another use of BCG vaccine which many people don't know of. So in the first stage we can give in intravesical, which we inject BCG vaccine into the bladder, where we filling the bladder with BCG vaccine. And why do we use BCG vaccine? What is the effect of BCG vaccine? See, I like to teach medical students that imagine BCG vaccine as a type of a food. Means how do I explain it to you? It's that suppose you go to a lake where there are fishes, and you put breadcrumbs, and as soon as you pour breadcrumbs into the lake, then the fishes will come. all the fishes will come where you have put the breadcrumbs. So BCG vaccines is like that, it's like those breadcrumbs. So wherever you put BCG vaccines, immune cells are going to come. जहाँ पे भी बीसीजी वैक्सीन डालोगे, इम्यून सेल्स वहाँ वहाँ पे भाग भाग के आ जाएंगे. वो चारा जैसा है, वो चारा वहाँ डाले, उधर सब मच्छियाँ भाग के गए जहाँ चारा डाले, वैसा वैसा है बीसीजी. सो if you put BCG in the bladder, all the immune cells are going to come to the bladder and they are going to fight off the cancer. And when this treatment is done, when the cancer is in the early stages, once the cancer starts attacking the muscle and it reaches the muscles layer also, you need to go for surgical option, cystectomy. ठीक है. And once along with chemotherapy, and once it has invaded metastasis, then your primary goal will be chemotherapy plus immunotherapy, but that immunotherapy will be different, it won't involve BCG. So this is one role of BCG which medical students do not know of. So thank you for listening to this series. I am getting messages from students that they are liking this series. They like that one small topic is being covered in one day. So thank you for your support. Keep supporting me, and like, share, subscribe to my channel. Please share it with your friends. Let's become better doctors together. Let's work together for a better future, for a better country. And thank you.